Hi, good afternoon. My name is Dr. Rafael Nepomuceno. I'm a physician with Access Northwest. I've been here for the past 3 years. Hi, Sonia.
Hi.
Hi, is my next patient here ready?
Sure.
Currently, our healthcare system is, we could say, facing unique challenges in terms of the population demographics. As probably a lot of people already know, individuals are getting older, and as a result, we're seeing more and more chronic diseases such as hypertension, diabetes, and also complications leading such as stroke, heart attacks, and things like that. In addition to that, we're also seeing more and more diverse population from immigrants and refugees from different parts of the world. And in addition to these demographic shifts, we're also seeing that the cost of healthcare has been increasing, and I think a lot of governments are facing the questions of how to make it more sustainable.
Hi, I'm Casey Nishi. I'm the Executive Director at the Wellness Institute at Seven Oaks General Hospital. Research shows that the average patient living with a chronic condition spends about 1 hour per year with their family doctor, another 1 hour per year with a specialist doctor, and about 10 hours per year with an allied health professional. So things like a certified diabetes educator or a registered dietitian. But what that really means is that the average patient with a chronic condition spends 364 and a half days managing their condition on their own. And that's why it's important that we as healthcare professionals make sure that patients have the skills to self-manage.
I'm Michelle Kirkbride, Hans Kai Coordinator here at the Norwest Co-op Community Health Center.
I'm Mike Sadowski, Health Promoter at Norwest Co-op Community Health Center.
Hans Kai is a community-led health promotion program that promotes health and well-being among its participants.
Originating in Japan, Hans Kai means group meeting. Hans Kai allows participants to take their onus of their own health upon themselves and lift the burden that's placed on the actual healthcare system.
Hans is a community-led program, but before they meet on their own, all participants go through a health school with trained Hans Kai facilitators. In the health school, we cover things like why to check your blood pressure and blood sugar, and how to do it. How do you manage your sleep and stress? How can you be physically active no matter what your mobility? How can we eat healthy? And most importantly, how can we work together? After they complete these sessions, the group members meet on their own independently, where they have a healthy snack, they participate in some form of physical activity, check their blood pressure, blood sugar, and waist circumference, but more importantly, have the time to socialize and support each other.
From there, facilitators can use the program to address any kind of needs that they need for either their workplace or the community, which could range from different cultures, genders, or basically just any different background.
I am Rosina Vincula. I work at Immigrant Center as the coordinator for the Neighborhood Immigrant Settlement Program. We have 10 areas in Winnipeg that works with newcomers. Also, I work at Aurora Family Therapy Center where I work as a newcomer community development worker. I am a newcomer myself too, 8 years ago, so I came to Canada with my family, and I know in terms of challenges, health is one of the biggest thing because there is this research about the newcomer health effect that before we come to Canada, we are at the peak of our health, and then when we started coming here, it started to go down because of different factors like housing, social isolation, sense of belonging, the health itself too, and the environment. So there's so many components of that.
What Hans Kai does is that number one, it provides education related to the most common modifiable risk factors for health, such as physical activity, weight, diet, things like that. And number two, I think, as I mentioned, it's also group-based, and it provides empowerment by having a support group led by peers that the patient identifies with. So, for example, we have groups that are based in places of employment. So, these are groups where the patient may feel quite comfortable monitoring their health with their fellow colleagues. Some are more cultural groups. So we just had a Syrian group that we just started, Hans Kai, It's a tight community, and I think it's a good fit for them because they're able to support each other as they go through the health monitoring process that HandSky puts in place.
My name is Denise Erskine, and I'm a member of the HandSky group at my workplace here at United Way of Winnipeg. My whole family has blood pressure, and for me it was okay for me, but not until I gave birth to my daughter. I inherited it, and I kind of tried to monitor it with the help of the program of HandSky at work here and to my doctor. I try not to depend on the medication or the tablets as such. I just try to eat like healthy vegetables and fruits and more of those things.
I would say it's been good, excellent, as a matter of fact, because it's given me an insight into my health. I have COPD, and blood pressure, but that's controlled. But it's given me an insight into how to work with it. You know what I mean? How to keep on top.
HandSky is a very nice adjunct when CDSMP, or the Chronic Disease Self-Management Program, concludes. HandSky offers an opportunity for those patients to continue to practice the skills they've learned and support their long-term self-management.
I developed strength, I developed communication, I developed my knowledge of education here.
The change that I found in myself is I was mentally stable of continuously going, where I would have been depressed if I was at home looking at four walls.
It's you have to take control of your own health. That's about the best thing that I learned and I gained from it.
So there is this one woman who told us that back home, women doesn't have any rights and they can take part of activities, but being part of this program, she felt like a human being again, and that she can take control of her own health and be part of a big community. So this is very big, very powerful, and you will be helping a lot more people with HandSky program.